I'm a maternal child health nurse assistant coordinator for the City of Melbourne. So I've got 3 centres and 11 nurses that I coordinate the staffing and the rosters for and provide clinical supervision and backfill if needed and just general support. I also coordinate and staff and resource the 3 breastfeeding clinics that we have here at the City of Melbourne. So make sure we've got an international board certified lactation consultant to work it and that they've got sufficient resources. I've been doing maternal and child health since 2000, so 16 years. I was a midwife for the preceding 6 years and a qualified nurse since 1989. Modern vaccines provide high level of protection against an increasing number of disease, disability and death. Serious reactions to modern vaccines are rare, and it's estimated that vaccination currently saves 3 million lives per year worldwide, which makes it one of the most cost-effective health measures we could use. When we immunise, we have a form that we give every mother with the exact time of the immunisation was completed, the date, what we gave and where we gave it, and we give them the batch number of everything we give. And so then we go through the possible possible reactions to the immunisations we gave and what to do if they occur. So, for example, with an 8-week-old baby, the reactions would be potentially a red and inflamed area at the injection site, and you can do nothing for that, or if you like, you can put a cold compress on. They get a fever, we give this. And if this or this happens, or any of the things that I've talked about happen and worry you, go and see a doctor. Immunisation works on a concept called herd immunity, so you need to have I think it's about between 92 and 95% of the population immunised to provide protection for the whole population from the diseases that are commonly immunised against. So once the herd immunity drops below 90%, we see epidemics of certain diseases. 2 examples spring to mind. Whooping cough. Victoria is just coming out of another whooping cough epidemic, and that kills babies. We haven't had a baby die of whooping cough for the last 12 months, which is a massive achievement. We need herd immunity. We need the percentage of the population that's immunised to be above 92%. So the legislation will help, because a lot of the children that don't have completed immunisation or up-to-date immunisation is just because the parents forgot, or it was hard to access, or they couldn't be bothered, or for whatever reason. I don't mean to be disparaging towards parents. So this has provided, the No Jab No Pay has provided a very real tangible impetus for them to get their child's immunisation up to date. Parents that don't choose to immunise because they don't believe in it, they can still make that choice. So the choice isn't being taken away from them, but they will no longer qualify for any of those financial benefits. We've been mad since the 1st of January. Probably not the 1st of January, probably mid-Jan. The immunisation team has been completely overwhelmed because, childcare started again and I don't have any money. They've cut off my Centrelink benefits because my immunisation's not up to date. Completely and utterly overwhelmed. And then maternal and child health, as the face of, for most people, have been bombarded. I think the science is really clear. Immunisation protects people in the community that are unable to be immunised for very clear and valid reasons, and they deserve that right to be protected. And it's not for me to tell people things shouldn't be discussed, and everyone has the right to their opinion and their right to express that opinion, and I strongly believe that we should create an environment and a culture where that's not only enshrined but celebrated. However, the anti-vaccination debate isn't based on fact or science, and I'm a nurse and we function very much in the realm of evidence-based information. So and they operate from fear. So every parent is frightened that they're, in a way that you don't understand until you become a parent, they live in fear of something going wrong or something happening to their child. And so how the anti-vaxxers operate is that they imply that if you do it, it's likely something bad's going to happen and it'll be your fault. And that's not based in fact nor supported by the statistics. But the theories are absolutely you know, it grabs hold and it's hard to reverse. And so, and especially if you associate the fear of doing something wrong with your children, you're always going to open up, you know, big grey spaces where, and then you throw in a bit of it's a government conspiracy, although I've always struggled with that one, because what would benefit the government to conspire to make everyone sick, you know. But anyway, so I support everyone's right to disagree, but I don't, I think that it's, you know, they operate from a very poor level. It used to be that if we had a family present and they said, look, I object to immunisation, or I wish to delay it because I object to my 8-week baby being immunised with all these conditions, if we were satisfied that they were making an informed decision, then we would sign a stat dec, and it was called a conscientious objector form, and we would sign it saying, I believe that this family have got all the information and they're making a decision based on all that information, which was quite challenging because people that choose to be, they're very strident in their views, and they are not based on anything factual. So for me to sit and have a conversation with a family that are anti-vaxxers and to then sign a legal document to say I've given them all the information, it was always a very challenging visit to do. We don't do that anymore, so you can't just conscientiously object because you don't believe in it. That's not a, you can still not immunise, but you won't get all those payments. But if a child has a medical condition, that needs to be verified by their medical practitioner, and then that medical practitioner now has the obligation to sign the exemption form. But I can't, they're life-threatening diseases. We're talking about leukemia and things that cause immunosuppression. So there's very, very few medical conditions that do that, because even for a very sick child, they need to be protected from these diseases. So there are very, very few conditions, but it's not our call to make anymore. I think probably internet access and social media has provided oxygen to the argument, and you can be anonymous. So there's no obligation to stand behind the facts or even present the facts behind the argument that you're presenting. So I think probably in the last 5 to 10 years it's grown, it's got a little bit more robust, not robust actually, it has grown, and that's because you can you can post stuff that's not, you don't have to substantiate what you say. We get notified when every baby in the state is born, and we go and do a home visit if they live in our LGA, and we discuss the fact that we provide it when we see you in the centre. So we plant the seed, if you like, at the home visit. At the 2-week visit we start to discuss it, and we make sure that they've read the immunisation information book, and that they ask any questions they have about it with us. And then at the 4-week visit we have a similar conversation. At the moment, because of the whooping cough epidemic, we're encouraging babies to have their first immunisation at 6 weeks, which is 2 weeks earlier than normal. And so we can't do that because we're constrained to deliver the national immunisation program only. So we discuss it, and then they end up having it at their GP. And if they don't get it at the GP, we'll do it at 8 weeks. But when we do it, we welcome questions and the conversation. But I think the biggest impact it's had is families that have forgotten or didn't realise that their child was delayed in immunisation, and because there's some financial money, there's remuneration attached, and or attendance at childcare, they've been madly knocking at the door. Quality, the high quality first grade research behind immunisation is irrefutable. There was a study done by a guy called Wakefield. He was working at a clinic, I think, around another condition, and he erroneously made a correlation between the condition he was working with, autism, and receiving the measles, mumps, rubella vaccine. And he did it on a cohort of 7 children. So from a research perspective, that's diddly squat and doesn't. But he published, and as a result, the UK had diminished. The public health ramifications are enormous. He's since lost his medical qualification, He has come out and stated that he was wrong, but because the obligation sits with the scientific and medical community to prove that vaccination works, as opposed to the anti-vaxxers proving that it doesn't, they went and did more research on to disprove the correlation on 2.6 million children, and the research is unequivocal that there is no association between the development of autism spectrum disorder and measles, mumps, rubella. Unfortunately, there are a lot of families who anecdotally, when they look back on what occurred in their child's life, they are very closely related. And so I think this is where things can become challenging, because a person's experience of a very challenging event in their life has to always be respected, even if you don't agree with the connections they're making. So people still will anecdotally argue that they are connected, but science, as much as it can, and that's pretty robustly, has proven that they're not. What we explain are the normal reactions that you could expect for your child in this time frame. So we'll say for the next 36 hours, these things possibly may occur. And this is what you should do if they do occur. But if they occur, it doesn't mean that they're allergic to the immunisation. It's just a body's reaction to something and we want it to have a reaction, because that's the point of it, create antibodies to the disease you're being immunised against. So if a child has a significant reaction, and they're very rare, then there's I don't know if it's an organisation, but we have to fill out a form to something called SafeVic, and then that's it explains what it is and what happened and what the reaction was to, and then we send that. SafeVic is located in the Royal Children's Hospital. They contact every family for every child that has a reaction that is outside of those normal parameters, and they bring them in and they discuss the reaction and talk about what, debrief if needed, and then discuss where to from here. And where to from here may be, we're actually advising that your child probably should not have that vaccine again, or do you know what, we'll give it in the hospital where we've got all the bangs and whistles we need if there is a reaction. And so it's a very, very structured, very, very clearly structured process from the beginning, and then if we identify a reaction, what happens and what supports are available for the family. So, and it's about information. We give information all the time about what may happen, what to do. We have phone calls here that we take when people are worried. Yeah, one other thing I was thinking about, because interestingly, both my sisters are anti-vaxxers, so this is a conversation it's a no-go zone, but we went hard and fast at it for a long time. And they're both health professionals as well, which is interesting. My eldest niece came to me when she was 19 because she wanted to travel overseas and she was unvaccinated and she wanted to know what she needed. So I went through what she'd need and the time frame she would need it, and it cost her over $1,000, because this is free until children reach a certain age, and then it's not free. So you know what, folks, you're making a decision for your children that they may not be able to afford to rectify when they're older. You can't get certain jobs at university unless you're immunised. If you want to work in research, you can't work in research unless you're immunised. So adults are making decisions for their children that there may be massive repercussions on every level. There is a lot of really, 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 really high quality, irrefutable science to say that immunisation is a very effective health measure.